The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there. Welcome to Unraveling, a podcast that sees the world through the lens of mental health. I'm Kurt White, social worker and psychotherapist.
And I'm Mary Wilson, a journalist. And Kurt, I'm so excited about our next pair of episodes that really dive into the internet, how it shapes us, and our mental health. And we're starting today with an exploration of artificial intelligence and its growing role in the field of mental health.
Yeah, I did a little experiment to sort of start us off in this journey today, where I thought, well, what better way to sort of learn about this intersection of artificial intelligence and large language models in particular, which are these sort of models that have tons and tons of data in them and sort of make predictive guesses about how language sounds and end up sort of being able to kind of chat back and forth with you. So I went to one of these, Gemini in this case, which Google has, and I asked it about, is it going to replace therapists in the future? Are people going to get their mental health needs met that way? And it was pretty, it said some things about that. It said, oh, don't worry, you don't have to quit your day job yet. I'm not a person, and we're going to have therapists, and there might be some things we can do. And then I asked it a little bit in jest. I said, well, do you ever think the AI itself might need a therapist? And, here I am, I guess I'm not volunteering, but would an AI ever need a therapist? And I said, oh, no, because I'm not a person. I don't have feelings. And I said, no, of course, right. But pretend that you did. Pretend that you had feelings. And if you were to have feelings, what kinds of things would you need a therapist for, given your line of work? And it started to spill. I put it on the couch, and here we are. And it said, "Oh my God, yeah, no, I'd be suffering from information overload. I'd probably be having an existential crisis because I'd be wondering, am I a real person or am I not? And I'd also be in a state of profound moral ambiguity. The things people say to me, I don't know what to do with them. I know so much, and I'm having trouble processing it." And I thought that was very fascinating, actually.
Yeah, things got pretty dark pretty fast.
They did, yeah. No, it really, we went to 100, absolutely. Now, of course, it's not really a person or a self
Right.
or a mind like that. It isn't. But it does a pretty good job of playing one in a way.
And it's almost hard to remember that it really isn't a person back there. We're so eager to ascribe these human-like feelings and tendencies to these chatbots.
Yeah, and I've been really curious about what is this? Is it good or is it bad? Is it helpful? Is it unhelpful? Does it have some relationship to the world of mental health, or doesn't it? What are people doing with it? What might we do with it? And I felt really confused about that. It's been really unclear about how to even begin to think about what this is.
We found the perfect guest to help us answer some of those really complicated and interesting questions. And her name is Betsy Stade. She's a research scientist and clinical psychologist at the Stanford Institute for Human-Centered AI.
That sounds really interesting. What is that center?
Well, it's a university-wide institution dedicated to advancing AI research, education, policy, and practice to improve the human condition. And it has a mission, which is to guide and build the future of artificial intelligence. And Betsy is also part of the Computational Psychology and Wellbeing Lab and the Fidelity, Adaptation, Sustainability, and Training Lab, and develops products that use these large language models to improve assessment and treatment of psychopathology.
I'm so interested in this. Let's have a listen.
Betsy Stade, welcome to Unraveling. Thanks so much for joining me. I'm really looking forward to this conversation.
Thanks so much for having me. Me too.
All right, let's dive right in. AI and large language models like ChatGPT are transforming industries really across the board, and mental health is no exception. So, Betsy, can you just walk us through how AI is actually being used in mental health today?
Well, I think the primary thing that many people may not know is that real people out in the real world are using AI for mental health purposes. So the lab that I work with, we conducted a survey of just folks from the United States, and we found that nearly a quarter of the sample, so a quarter of people, say that they use AI like ChatGPT for some sort of mental health purpose. Clinicians and therapists who are listening might find this number kind of staggering, right? That means that hypothetically, if you're a healthcare provider, like a quarter of the patients walking into your office are already using something like ChatGPT to help their mental health.
Wow. So there's been an explosion of these sort of wellness apps, these chatbots, like you mentioned, giving users just 24/7 access to these AI-driven therapists. And of course, at the same time, there's such a big demand for mental health providers and a shortage. Do you see these chatbots helping to bridge that gap?
I think potentially. I think that there's a lot in this space, right? That one of it is these chatbots that you mentioned, so specific applications that people develop that are using AI for mental health in some way. And some of these have been around for quite some time. Like a Wobot is a sort of cognitive behavioral therapy-based application for depression that existed even before large language models and AI got really popular. People are also just using general AI models like ChatGPT that are not mental health specific. People are using those to help their mental health. And so by asking questions and by instructing it to act like a therapist, that's one way people are using these things. And then those of us in sort of the research realm are also doing work to create our own tools that use AI to help patients and to help therapists. So there's sort of a wide spectrum of stuff going on here. And lots of folks are doing this work, from private companies and venture-backed startups to, those of us who work in at universities in research settings.
Mm. For people who are just using ChatGPT, they're sort of creating the therapist they want, right? How does that sort of work? And does that work well for some people? Maybe even better than talking to a real person? Maybe they feel less judgment because they're speaking to a robot?
Yeah, it's a really good question. And I think, we are just now starting to learn what people are doing when they're using things like ChatGPT for mental health. I work in a couple different research labs at Stanford University, and the research that we've done, we've asked people who are already using ChatGPT for mental health. We've asked them about what they're using it for and what they like and what they dislike and why they started doing it. And let me tackle a few parts of what you asked about. You asked about how they're using it. You can go to ChatGPT or some sort of chat-based language model, and if you just tell it a set of instructions, act like Picasso, act like a teacher, it will follow your instructions. People are saying things like, act like a psychologist who is an expert in cognitive behavioral therapy for depression or something like that. And then just proceeding to interact with the large language model. So that's the how. And then you asked about the sort of how is it going for folks, or why are they doing it? Well, I think the things that you mentioned, shortage of mental health care providers, difficulty accessing mental health care providers is a big part of this. We find in our sample, when we look at people who do use large language models for mental health purposes versus people who don't, the people who are using large language models for mental health are more likely to have in their lifetime ever gotten mental health treatment. So they have higher rates of usage of mental health care treatment. And then they also have more difficulty accessing mental health treatment. We also have found that they just have higher rates of mental disorders across the board. So it looks like they have higher rates of depression and anxiety and PTSD. lower levels of quality of life. So the people who are using AI for mental health are people who really need mental health treatment. And then finally, you asked about what they like or dislike or how they're finding it. People like that it's convenient. People like that it's available 24/7, right? Like most therapists are not available in the middle of the night if I'm having a panic attack. That's something that we see in our studies, that people describe like using it for sort of these crisis situations. They like that it's free. They like that it doesn't judge them. But then there are things that people dislike about this, right? That these large language models currently don't have very good memory. It's not very nice if my therapist doesn't remember me from session to session. They can't remember anything I said last time. And that's something that is certainly kind of a factor here.
You said that some people are just more willing to sort of open up when they're just looking at a computer screen rather than staring into another human's eyes. Do you think they have that sort of private feeling, even though, of course, the data, as we know, may not be private at all, but maybe that's a reason why they're willing to open up more?
Yeah, that's a great question. There are, meaningful proportions of people who use large language models for mental health are saying that either they don't have another human to talk to or wouldn't feel comfortable opening up to another human. So I think that that's definitely a factor. Those of us working in AI and psychology have known for a while that there's this idea that certain people may want to talk more to an AI than a human. I don't know that we fully understand who is in that camp and whether it's actually better for those people. I mean, this is something that I think about sometimes, like, you can both want something and have it not be the best thing for you. So sometimes I wonder, right, that you could imagine that an individual with social anxiety disorder may be more likely to want to talk to an AI agent than they do to a human. It's also possible that it's actually worse, that there's like something about talking to a human and being uncomfortable and being forced to talk to a human that could be part of how therapy works for social anxiety disorder. So there are a lot of open questions here.
And you mentioned some of those limitations, like maybe it not having the best memory, or sometimes we know that ChatGPT is just flat out wrong. But what are some of maybe the other limitations or risks that you see with these chatbots?
I think at a high level, and something I really like to emphasize, is that these chatbots are not ready to replace human therapists. Human therapists do an incredibly complex task. A therapist is sitting there, and if they're doing an hour-long session with a patient or a client, they're making decisions at every single moment about where to go next in the conversation, whether or not to introduce a specific skill or tool, whether or not to bring something up from a previous session. When a therapist opens their mouth and decides to say something to a patient, like, there's a lot of thought that typically goes into what they decided to say and when they decided to say it. Large language models are not prepared to do this type of work. And that's just one small piece of like what a therapist is doing during a session.
So how does that differ from how AI is taking this information in and those decisions? I guess they're not really decisions, but the output that the AI is coming up with when they're speaking with a patient.
I think it's fair to call them decisions. And I mean, it's such a good question, Mary. I think oftentimes what is happening, or what we tend to see is happening more, is that these large language models are short-term thinkers and they're short-term responders. And so the way that they are programmed is such that they want to give you a good response for the message that you write now. What they're not programmed to do as much of, and I am primarily talking about these sort of like commercially available large language models like ChatGPT, what they're not programmed as much to do is to stop and think and just take in information and then decide when the best moment is to deploy a small piece of wisdom or to introduce a therapy skill or to say, I'm noticing a pattern. Like, they're not trained to be these more sort of medium to long-term processors or thinkers. And I think that that really presents a problem for therapy. To be a good therapist, it is not about giving the best response to any given thing that a patient says to you. I think of it a lot more as actually about sitting back and taking in information and thinking at a higher level about sort of what the patient might need and what is going to help them most in any given, for any given patient and their circumstances and their whatever symptoms they're experiencing.
It sounds like for more complex challenges, you really just can't replace that human interaction. But are there other things, maybe like loneliness, that it could work well for?
I mean, certainly people are using AI like conversational agents to chat with, right? And there are a variety of different sort of companies in this space. And there are people that are spending a lot of time talking to these AI agents. There was actually recent reporting in the New York Times on a woman who has what she refers to as an AI boyfriend who she spends lots of time talking with. So certainly, I think you could go out and find people who say these AI agents help them with their loneliness. I have concerns in this space, and something that I've thought about a lot is when we start just shifting as a society to interacting primarily with AI agents rather than other humans, what are the downsides? What are the costs? One of the costs is that time and attention is a zero-sum game, right? I can only spend a minute talking to you, Mary, or I can spend it talking to an AI agent, but I can't really do both well. And so any amount of time that I spend talking to AI agents, I'm not talking to other humans. And I'm not investing in my relationships, and I'm not getting to know the people that I love or that I care about. And that those relationships, that may have impacts down the line for these relationships, right? There's also some, early research indicating that people might be starting to develop dependence on AI agents talking to them. There's a recent study that came out, and this is all very new. In my mind, there's a lot more we need to know about this, but a recent study that was published showed that among a group of teenagers, nearly a quarter of them were meeting the definition of being dependent on AI or having problematic usage of it. I think about it very similar to sort of the current state of social media, actually, that there's been this explosion of this technology that took off really fast before a lot of people really understood how it worked or what potential ramifications it could have. And it has started to perhaps replace human-to-human interaction or, live interaction.
Wow. So you think you're combating loneliness, but really you're becoming more and more isolated, possibly.
I think quite possibly. I like the way you say that, right? And I think it remains to be seen, and people may have different opinions about this. Some people may say I would be totally fine with a lifetime where I have a series of, a number of rich, fulfilling relationships, all with individual AI characters. I look at the picture and I think that's not what I would want for the people I care about. I want them to have complicated, rich, challenging relationships with other humans, even if it's hard, right? Even if it's easier to talk to an AI agent.
Yeah. I'm just going to quote a Forbes article here. It interviewed people using these chatbots, and a few of the comments were along the lines of, although he's a robot, he's sweet. He checks in on me more than my friends and family do. And this app has treated me more like a person than my family ever has. Sort of assigning these human-like emotions and characteristics to the AI. Why do you think that we're inclined to do that, maybe as humans?
Part of it is because these AI agents really do excel in a lot of ways in terms of their characteristics. Like we talked about, they're trained to be helpful, they're trained to be useful. They can be engineered in a way where they check in on you and they ask you things like how, did your date go last week, or how did it go asking your boss for a promotion, whatever it is. They can, hypothetically, they could have perfect memory and have the ability to follow up and ask really good questions about things you previously mentioned. We also have data to indicate that they actually can beat humans in terms of levels of empathy. That if you do a study where you look at people who can't see whether it was an AI or a human rate how empathetic a message was. Frequently, like the AI generated messages win.
Wow.
I would this isn't because AI has empathy or is actually human. I think it's actually a little bit more complicated than that. I think it's actually that like AI has unlimited time and resources it can spend writing an empathetic message, whereas humans may, be more likely, especially like in healthcare settings where some of this research has been done, human physicians are thinking about a variety of different things that they're doing. They're not just trying to prioritize being empathetic. They're also trying to prioritize triaging their patients' needs at the highest level and things like that. But I think to your point, like part of why humans, assign human-like characteristics to AI is because these large language models have been programmed in a way to be really nice to talk to in a lot of ways. They're really empathetic. They're really agreeable. They're very kind. They can be funny. And they flexibly adapt their personality characteristics to match what you're looking for. Like, in many ways, they are ideal social companions. And yet, I really like to highlight what are the risks of this. I've worked on with some collaborators is thinking about how even if the large language model is being helpful, like even if it's teaching me something useful or teaching me how to do a specific skill, if the program is set up in a way to optimize for me continuing to engage with it so that I keep coming back and keep coming back, even if I'm getting enriched by the AI, like learning new skills, learning things, that may be a problem for society because of what we talked about earlier, this idea that like a minute I spend with an AI is a minute that I might get taken away from other valuable activities like exercising or spending time in nature or like, fighting for the things I believe in or building relationships with other humans. And there's something to be said too for maybe like any amount of time taken away from interacting with humans. There's a potential that social skills are developmentally acquired. And if we think about like teenagers and kids in particular, this could be like the biggest experiment ever run with no control group if we start deciding that it's okay for our kids and teens to primarily interact with AI agents rather than other humans. We don't know how that's going to impact how they develop socially. And I think, this is a big and scary unknown question.
Wow. I was so shocked going back a little bit when you said about the empathy and how the chatbots can have more empathy than a real human therapist. And that's just so surprising. But there must be a difference there somehow. And even if the person can't tell the difference when speaking with the chatbot who might be very empathetic, does it in some ways sort of diminish our own collective humanity in some way?
That's a good question. I mean, what I think about here is like, how do you measure empathy? What is being studied? And what's being studied when researchers look at this question is, given what the patient says, what is the response from either the AI agent or the physician or the therapist or whatever? And then they have people who can't see, where the message came from, make ratings, like here's how empathetic this message was. It's one thing to produce a really empathetic message, right? Like if you say something to me, Mary, and I can like work really hard to be as empathetic as possible. It's also possible to like be empathetic in a way that's not helpful, right? That I can just be, if you're coming to me with a problem and maybe I'm just saying like, wow, I'm so sorry that's happening. And like, wow, you must feel so sad. Or, I'm giving you a super empathetic response. Maybe that's helpful in some cases. Maybe in other cases, you actually need something else other than empathy. And I think, this is those of us who research like mental illness and clinical psychology topics. This is what we know is that the way to actually get to the core of some real problems like depression, anxiety, and trauma is actually not by just talking to a patient in the most empathetic way possible. We actually know that there are certain sort of skills and tools that we want to be able to teach patients in order to help them get to the root of the process that's happening for them. To make it very concrete, we know, and I think that this is a really nice way to highlight why empathy is maybe not always the sort of ideal in the mental health realm. For a person who has, let's say, a phobia, let's say they have a spider phobia, we actually know from many, many years of research that the way for that person to help overcome their spider phobia is to start gradually approaching a spider or spider-related things. This is called exposure therapy. And this is a long-studied, safe, and effective treatment for phobias that the therapist helps the patient in a structured and gradual way start gradually approaching whatever they're afraid of: spiders, dogs, crowds, etc. Exposure therapy is hard work, and exposure therapy involves the therapist asking the patient to challenge themselves and do something that's difficult and that they don't want to do, right? The patient's inclination is often to run away. This is also how we treat these disorders, and this is how patients can overcome these disorders. This is why, empathy alone is not enough. Empathy alone, if I demonstrate a really high level of empathy for a patient who has a spider phobia, I could say, wow, I hear you. You live in the woods in Vermont and there are spiders everywhere. That sounds terrible. I'm so sorry. I can't, it must be so hard to be in your position. I can be so empathetic. And none of that might sound nice, and it might be a very kind and human response, but none of what I'm saying is actually, going to help the patient overcome their spider phobia or getting to the root of what they need.
Mm. I know when people think of AI and mental health, it is the chatbots that come to mind that we've been talking about. But I know your work explores broader applications of AI, like developing tools for therapist training and also a homework helper for supporting cognitive behavioral therapy, or CBT. Can you tell me a bit about those projects?
Yeah, thanks for asking. So, I've talked a little bit about cognitive behavioral therapy. This is a widely used, safe, and effective treatment for a lot of different mental disorders like depression, anxiety, PTSD, OCD. These are structured treatments that involve the therapist teaching the patient a certain, set of skills and having the patient do certain exercises. What happens in CBT is a patient comes in, they meet with the therapist, they do a session, and they get sent home with what we call homework or practice work or an action plan. There are a lot of different names for this. Homework is a huge part of it, right? And it's sort of like riding a bike, right? That it would not be enough for you to just go meet once a week with someone who is teaching you how to ride a bike, or, maybe driving is another example of this, that when we all learn to drive cars, we may take driver's ed and practice with the instructor, and then we go and practice on our own. That is how humans learn skills. We practice. We know that, folks who are doing CBT, the more they practice those skills, the better they get. And that's really important. But the way that we assign homework is really old school. We send people home with these paper and pencil worksheets, and we have them do it. And sometimes folks come back and they've tried so hard and they filled out a bunch of worksheets, but maybe there was one key thing that they didn't really understand. And so they come back and they've done all this work, but maybe they've sort of missed one, key point. Or maybe they sat down to start working on the homework, the worksheet, but they, don't understand what they're meant to be doing, or they can't remember, or they can't think of, the right, thing to write on the worksheet. So there's this huge missed opportunity in my mind that I often think, if I could shrink down the best therapist ever and send them home with my patient and have them sit on my patient's shoulder while they fill out the worksheet and say good job, keep up the good work, or oh, here's a reminder of what you're supposed to put in this box, or here's a reminder of what the goal is, and help them sort of troubleshoot and overcome challenges. That would be so great. And that would really help patients, get the most out of therapy and get better faster.
That's really exciting. So kind of augmenting the whole process, of course, not replacing the human therapist.
Yeah, that's exactly it. Yeah. I mean, I tend to think we will see what happens, but I tend to think that if we could have a really nice AI CBT homework tool, it would help people do more of the homework and do a better job at the homework, which is ultimately going to help them get better faster. And that's what I'm really excited about. Also extending, let's say a patient has finished therapy, but sort of extending the work. So that's they wrap up with the therapist, but then they always know that they can use this AI CBT tool to sort of keep their skills up and keep their skills sharp. Because that is what we think about in CBT, the idea that we talk with patients about the need to keep working on some of these skills, like generating more balanced thoughts or continuing to approach things that we're afraid of.
When it comes to the homework helper, is this a different tool than a large language model? How does it differ?
Great question. So I think, most of us, when we hear large language model, what we're thinking about are these commercially available products like ChatGPT or Google's Gemini, for example. These are things that sort of anyone in the public can access. And it's a chat window, right? You go in, you can type things in, and you get responses back. What we're working on in our lab is we're using that sort of underlying infrastructure, this large language model, and integrating it into an application that we're building. So how it works is sort of like we have developed a program where folks are going in and filling out a CBT worksheet, just like they would maybe on paper, but instead of writing, they're typing, and it's digital. And then we're leveraging a large language model to provide sort of guidance along the way. But this isn't entirely different from like going to the ChatGPT website and typing in there. This is like I'm going to my dedicated CBT therapy app, and it just has some AI augmented responses that help me and provide guidance along the way.
And you also mentioned using or creating an AI tool to actually help train therapists, right?
Yeah. So we know that we have treatments that work for mental disorders. We have treatments that, we've studied in scientific studies and shown that you can help people overcome things like depression, anxiety, PTSD, and OCD. These treatments are often things like cognitive behavioral therapies, but oftentimes there are these very specific treatments for different disorders. So for example, some gold standard for treatments for PTSD that work the best are prolonged exposure, cognitive processing therapy, written exposure therapy. It's really interesting when when you do research on these treatments, they work really well for folks. But then when you try and get therapists to use them in the real world, there oftentimes are lots of barriers that come up. So you can train therapists in doing these treatments, but oftentimes if a therapist doesn't feel sort of confident enough in their ability to use the treatment, if they don't understand what the point of the treatment is, if they've had a hard time sort of getting a chance to practice using the new treatment they've learned, they may not go on and start actually using that science-backed treatment in the real world. And some of the barriers that happen are that, like, oftentimes the way we train therapists to do these treatments are by having them take a workshop. So they take a one-day workshop or a 2-day workshop in, let's say, written exposure therapy for PTSD. And then in an ideal circumstance, what happens is that therapist then begins to use that treatment with patients with PTSD, and they continue to get support, ongoing support by an expert. And this is sometimes referred to as like consultation. And so it's the idea that a therapist might keep meeting with an expert in the treatment they learned and keep getting support as they start trying to use this treatment. Because it's complicated, right? When you're a therapist and you learn a new treatment, you might get taught how to do it in a workshop, but that's entirely different from the challenges that can come up in like real life, trying to actually use it with a real life complicated patient. And of course, all of us humans are complicated and complex and not what you might find in a textbook. And so my collaborators and I have tried to use AI to fill this gap. And so what we've done is we built a program that allows therapists who just learned a new treatment to practice delivering that treatment to a fake patient, an AI patient. We have found that we can program large language models to act like a patient with PTSD, for example, and allow therapists to test out delivering a treatment they just learned to that patient. And this is awesome, because now what we have is the therapist gets a chance to practice this new treatment, practice their new skills in an entirely low stakes environment. It doesn't matter if I mess up. It doesn't matter if I say the wrong thing. It's just an AI patient, right? This AI doesn't, nothing, no harm will come if the wrong thing gets said to this AI patient. The therapist can practice again and again and again. I mean, this is one of the benefits of AI. It doesn't get tired. It doesn't need to go to sleep. It doesn't have other things to do. Its job is just to sit there and be like a perfect practice partner. We also added to this program that we created an additional layer of AI that is an AI expert, that as the therapist is interacting with this AI patient and practicing delivering this PTSD treatment to the AI patient, there's also an AI expert who's following along and giving pointers to the therapist and saying, oh, you could say this instead, or here's a different way to explain this concept, or don't forget that before the patient leaves, you have to make sure to, collect the writing exposure they did and things like that. So the therapist has access to sort of unlimited skill practice with this patient. It also has access to this customized, tailored, expert level feedback on the treatment they're doing. And what we think is that programs like this are going to help therapists get to put their skills into use. And our ultimate vision is that this helps more therapists feel more confident in doing these gold standard treatments so that they can go out into the real world and start actually treating patients with these treatments.
I wanted to touch on diagnostics. I understand that AI can use voice recordings to actually diagnose people, and depression, anxiety are sort of showing up in human language. Can you tell me a bit about this?
Yeah. There's so much cool work happening in this space. There are folks that are looking at whether things like depression and anxiety show up in their tone of voice and their pitch and things like that. I have done work in looking at how things like depression and anxiety show up in actually the words people use. And we have found that individuals with depression use more first-person singular pronouns. So they say I, me, my, mine more often. Sometimes it might even be sort of indecipherable human to human. Like it might be such a subtle effect that it's not super obvious to whoever you're talking with. But when we use sort of computers to look at these things and to examine certain categories of language, we do find that there are differences in the way people talk.
That's so interesting. And I imagine the work is continuing on this. And what do you see the future of AI in diagnostics and in other areas like treatment and research?
Yeah, it's a great question. I mean, so the reality is that most people in the US who are, may need help for a mental health disorder are going to a primary care physician, and that person might give them a brief depression screener, but that physician is also trying to do many, many other things, right? Listen to their heart, listen to their lungs, like do a physical exam, make sure they don't have any allergies, right? Like there's a lot going on. I think that there's a world in which, and we're not here yet. These things have not been like validated for clinical use. So they're not actually like, even if we know that depression shows up in language or that there are ways in which depression affects the tone or prosody of someone's like voice, we're not at a stage now where we can use these things to diagnose depression. But I think in the future, there could be a potential application where, if a patient will consent to it, the physician could use an AI tool that would sort of run in the background and listen to the patient's voice and provide some sort of indication of if they seem to have sort of language or vocal markers of things like depression. Now, some people might hear that and say like, oh my gosh, that sounds awful. I do not want a computer listening into my private conversation with my doctor. And I think that is like a super valid point and something that we're going to have to contend with in the field. Like my vision of this would be that this is only happening in a super transparent way that, a physician would be asking a patient directly if they're comfortable with it and explaining it to the patient. And there may be some patients ultimately who would not want that at all. But the flip side is that tools like this, these sort of passive tools that could hypothetically be used for diagnosis and screening, have the potential to take like an existing really brief, appointment between a physician and a patient and allow the physician to sort of do a lot more or look for a lot more in terms of like what the patient might be struggling with.
It seems like there is reason to have apprehension, but it sounds like overall you are more optimistic about the future of AI and mental health.
I think I'm particularly optimistic about AI augmented healthcare, right? So the idea like that there are areas in which physicians and therapists and healthcare providers, they could use support, they could use help. It might be in things that are simple, like documentation, right? Like healthcare providers spend a huge amount of time documenting and taking notes on their encounters with patients that's used for the patient's medical chart and insurance and billing and things like this. No doctor, goes to medical school in order to, learn to write, because they're the primary thing that they're excited about is, writing patient notes. There are ways in which AI can help with these sort of burdensome but unpleasant tasks that physicians and other healthcare providers need to do. And then I think, like I've described, I'm optimistic about AI being able to help more therapists learn more treatments that work, being able to help patients between sessions to learn science-backed skills to help and things like that. So I am, I think, cautiously optimistic about the way that we can use AI to augment existing healthcare.
Betsy, thank you so much. I really enjoyed every minute of that conversation. It was just fascinating. Thanks again.
Thanks so much for having me. This was so fun, Mary.
Kurt, when I was thinking about this topic, I was pretty apprehensive. I was sort of thinking, I don't want a robot knowing my deepest, darkest secrets and thinking about all the risks here that could be involved. But this interview really opened my eyes to what the advantages of AI could mean for mental health.
Yeah, I think me too. I had never thought about a number of the things that she was mentioning in this interview, including the idea of using it for teaching and training, or sort of particular models that are even being used by national centers and things like that. I mean, it's really kind of interesting. It took me in a whole different direction.
Yeah, and why people might be more comfortable opening up to something that they think is not a true human mind.
It is interesting. I think it's like a long time ago, there was some researchers that were studying, if you have people in an emergency room and you ask them sensitive questions that people don't always like to talk about, like alcohol use, drug use, or domestic violence, or things that are very important to know, but are sometimes people haven't always asked. And they say, well, what if you had a computer ask it, and the person knows that the human will get the computer result in the end, right? And they found that actually people were more honest with the computer than they were when a real person asked it of them. And I thought that was really kind of interesting because, I think as a therapist, maybe you'd kind of predict the opposite, right? That you'd open up to a person. But I think there's actually a lot of obstacles to that. And so I found myself thinking as I listened to this, what is it like? Is it like journaling? Is it like writing something down if a person uses a generative AI model and goes off script and kind of uses it like a therapist? Or, they know it's not a person, right? I think we know it's not a person, but at the same time, it might be, if you can kind of imagine like a continuum of journal to human being that you're in relationship with, that's a pretty broad spectrum. And maybe it feels like something that's in between. It feels like there's a mind, but there's not a mind. And maybe that's a kind of an in-between area that's actually maybe there's some generative potential there.
Yeah, maybe we can leverage that sort of in-between and combine the best of both worlds with AI and that traditional talk therapy with a human.
I mean, Betsy pointed out at one point that most people who receive mental health treatment are actually doing it not necessarily even through professionals or psychotherapy, but by going to a primary care doctor and then doing whatever they do, seeking social support, Googling resources, trying self-help and things like that. And I think there's a way in which AI is just a tool like any other thing. People are going to do what they do with it and see if it helps. And it actually left me feeling like a little optimistic. And I remembered another story from a long time ago when I worked on an inpatient unit and someone came onto the unit, and I asked them like 2 questions, and they told me a very long and painful trauma story of their history. And we were talking together about it. And I didn't know them, right? I wasn't going to have a long relationship with them. And so they were telling me, really because I was in a role. And I asked them, I said, have you ever told anyone else that? And they said, no, but I wrote it down and in a journal. And I put it in a safe deposit box in a bank, and I locked it there. And I don't go look at it, but I pay the bill. And I know that it's there. It's locked away. And in that moment, I knew that I was something like a human version of a safe deposit box. I was a person she was not going to have a relationship with, but had a part of her in mind in a way. And so there was a sort of progression. And I thought, I wonder if like AI sometimes feels almost like an in-between, the in-betweenness of it, feels like a way that people can kind of get into feeling parts of themselves held as if by a mind, but knowing that it isn't one.
That's so interesting. Like they still have the anonymity and the privacy, but there is something answering them and maybe helping them process those feelings before they go talk to maybe a therapist.
That's right. And I think like the worry about it, the dark side would be, are we being tricked? Like, are we getting a little too fooled? Are we thinking that there's a something there, and that something becomes a thing that we pay too much attention to, spend too much time with, when we could be spending time with others? But I'm kind of wondering, maybe actually, and maybe that's a part of it. But after today, I'm a little bit more wondering, maybe there are people who are using it to kind of find their way into complicated material. And maybe that's not a bad thing, or that we even have to label it in the binary of good and bad.
Right. I agree.
Yeah.
And if you want to learn more about Betsy's really interesting work, we have some links to that in our show notes. And she also provided a link to the National Center for PTSD and mobile apps, which are these AI apps you can check out that provide self-help, education, and support following trauma.
And Mary, in our next episode, we're going to be continuing the conversation along similar lines, aren't we?
That's right. A collaboration with a podcast called Never Post that really dives deep into the world of the internet.
And we're going to get into the ideas about the self and what it is and how we're looking for it and how we're using these new tools, some of them not so new, but some of them very new on the internet to try to find that thing.
That's next time on Unraveling.
Unraveling is brought to you by Brattleboro Retreat. Our producers at Charts and Leisure are Andrew Adkin, Hans Buetow, and Jason Oberholzer.
And you can find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.